And the other thing is, in terms of, I'm joined by Niamh Colfer, and Niamh will be here to answer any questions that you have. So in terms of the chat, and just before we kick off, maybe just to find out where some of you are coming in from. So I might start off with you, Brandon, because you're right next to me on the screen. So what do you do? Where are you coming in from?
I'm a personal trainer, strength coach. I'm coming in from Edmonton, Alberta, Canada.
And from Canada. Very good. And Stephanie, where are you coming in from?
I'm from Ohio.
You're coming in
Yoga teacher, Ohio.
From Ohio, yoga teacher. Great. Christina, where are you coming in from?
Hi, I'm from Boston, Massachusetts. I'm an orofacial myofunctional therapist.
Great. Already a large, diverse range of people, and we're only 3 in. We'll see how different it keeps going. Andrew, hi. Where are you coming in from? What do you do?
I'm in Miami, Florida, and I'm a peak performance coach, yoga, breathwork, meditation, mobility, all the things.
Great. And Annie Hickey, I don't know if you can hear me there, but where are you coming in from? What do you do?
Yeah, I can hear you. On the computer that I'm on doesn't have video.
Okay, no problem.
But I'm trying to, I got an iPad, so I'll try and get on there. I'm from Newfoundland and Labrador.
Very good.
In Canada, and I'm a Tai Chi instructor.
Great, hence the Irish name.
Yes, definitely.
Mike
from
Ramirez.
Munster, I think. I think we're from Munster.
Munster, yeah, down south.
Yeah.
Cool. Great. And Mike Ramirez, where are you coming in from? What do you do? Sorry, there you're on mute.
There you go. Sorry, I'm on the move here, trying to get back to the apartment. But
no worries.
What's up, everyone? I'm from New York City. I'm a health coach, and I just educate others on taking ownership over their health through breath, movement, and nutrition.
Great. New York City.
Yeah.
And we'll just say to 2 more people. Marta, where are you coming in from, and what do you do?
Hi, I'm from Boston, right outside of Boston, Massachusetts, and I'm a physio.
Great. 2 people from Boston. And Cynthia, where are you coming in from?
Bloomington, Indiana. I'm a health coach with breathing workshops and all kinds of other helps for people's health.
Okay, cool. So quite a few people are already into breathing, which is great. I'm going to go through a presentation and just in terms of giving my thoughts of, I suppose, the future of breathing. Where do I see it going? What makes an effective breathing instructor? I think it's a very important question to ask. Breathing, of course, now it's gaining a lot of traction. And before I start, I'm just going to hit record. This is our masterclass, and it's evening session. It's the 6th of August, 2024. And I'm kicking off with a small presentation. A question that's worthy of asking is, in order for breathing to become mainstream, I think we have some parallels with what makes an effective personal trainer. And it's not just an effective personal trainer, but it's anybody who is working with specific clients with the view of helping to improve their health and wellness. But in this situation here, an effective personal trainer, they will have a good array of technical expertise. They're going to have good background knowledge in exercise science, anatomy, and nutrition. They're also going to be effective communicators. They can listen to their clients, they can understand what their clients are saying, they understand the materials, and they're also able to explain to the client exactly what they are expected, that's in terms of the program that they are offering their client. An effective personal trainer is able to solve problems, they're able to monitor progress, they're able also to identify any weaknesses and also assess that person's fitness levels. That's very, very important. And on the back of that, they're able to adapt and customize an exercise routine to the individual needs and wants. And of course, then to motivate. Now, a breathing instructor should be no different. A breathing instructor should have the technical expertise and a good background in science when it comes to breathing. It's very, very important. I think the credibility with breathing is when the breathing instructor is able to explain breathing from a number of different dimensions and to explain what is actually happening, as opposed to just giving maybe something that's out of thin air, for example. A good breathwork or breathing instructor is able to effectively communicate the different exercises to the client in a way and a language that's accessible to the client. And they're also able to monitor and solve any problems when it comes to breathing, or at least as best that they can do it. When it comes to breathing and working with students, everybody is different. And we also need to tailor a breathing program based on age, state of health, and breathing patterns of the individual. Just as an effective personal trainer would adapt and customize a program based on age, state of health, and fitness levels. Instead, as a breathing coach, we're going to adapt it based on age, state of health, and breathing patterns. And of course, part of our role is to motivate. So breathing has so many parallels with what you're already doing. And the one thing about the breath is that it has quite a significant influence on the autonomic nervous system, that we can directly influence it, probably more than any other modality. But the key question is how? And that's what makes it exciting and important at the same time. I'm going to ask you to do this test. I'm going to take the camera off you, and this is simply the body oxygen level test. I will explain the significance of it. And basically, it's the length of your comfortable breath hold time. So if you're ready, and if you have a timer, if you have a watch or a phone or something like that, just to time it, I would like you to take a normal breath in and out through your nose and pinch your nose with your fingers and time it in seconds. How long can you hold your breath for until you feel the first definite desire to breathe, or the first involuntary movement of the diaphragm? Or another way to ask it would be, how long can you hold your breath for and still have normal breathing when you resume breathing? So that's the key point. So this test assesses your breathing from a biochemical point of view, but also it will give you feedback from a biomechanical point of view and a psychophysiological point of view. It's a simple screening tool that you can use with any of your clients. There is a paper on it by Kyle Kiesel, professor of physical therapy, and he looked at 51 individuals. He looked at their breathing from a biochemical point of view, a biomechanical point of view, and a psychophysiological point of view. And his conclusion was that comfortable breath hold time, along with 4 questions. The 4 questions are not so important, but it's the breath hold time is an easy screening tool. And I will come back to that. So hopefully you will have it measured. No doubt you have some questions. When do you let go? When precisely do you let go? Again, think of it. You're taking a normal breath in through your nose and a normal breath out through your nose, and you're pinching your nose and you're holding your breath, and you're holding your breath for as long as you can, but still have normal breathing at the end. It's not that you're trying to squash your breath here or suppress your breath. It's normal breathing, and that's the key. A little bit about myself. I came into breathing about 25 years ago because I had my own personal health issues. Most people come into breathing because of their own personal health issues, or at least that's the way it was back then. And I think it's still to some degree now today. I had asthma, I had a stuffy nose, I had poor sleep. And if you have asthma and a stuffy nose, you are more likely to have poor sleep. And if you have poor sleep, it affects your cognitive function. So my concentration was quite poor, and I did a lot of overthinking. I never considered myself to anxiety, but I lived a lot in my own head. And for me, breathing was really, really an amazing tool for me to apply back then and ever since. It's free, it's accessible, and the key is understanding really about breathing. And there's a lot of information out there about breathing, and sometimes breathing is a little bit of a minefield, and it's important to understand, like, what are we looking to achieve? What does your client want to achieve? And what's the best way to assess their breathing patterns to tailor a breathing program that's suitable for your client? The techniques we have been using, we use about 25 different techniques. So 25 different breathing exercises tailored to the client. We have a vibrant community of over 13,000 healthcare professionals who have attended our courses. So they have attended either our courses face-to-face or online. And we would be a market leader in terms of e-learning platforms. I've written 10 books. I have a new book coming out in 4 weeks. And I've also signed a contract for a 2-book deal for the United States with Humanics Books. And one of those books is Breathing for Yoga. It's currently published just recently in the UK, Ireland, Europe. And that now will be published in the USA in the next few months. And I also have to write a new book on sleep. So breathing and sleep. And we have, over the years, millions of people who would have used our techniques, either via videos on YouTube, our books, our training courses, etc. See, the thing about when you're doing something for 22 years, you kind of get an understanding, a deep understanding of what works. And also you'll make some mistakes along the way. And I think it's important that any of the instructors who are coming in to train with us, that they don't have to learn the same, they don't have to experience the same mistakes that I've experienced, because I want to communicate in a way that, yeah, you can learn from my experience. Key pillars of our program, there's 2 aspects to it, and it's very important to think about everyday breathing. If you're a breathwork instructor, think about your clients' everyday breathing patterns. Functional breathing is the foundational breathing. This is how you breathe every minute, every hour, every day, during rest, during physical exercise, and during sleep. There is a way to breathe to improve your blood circulation and oxygen delivery. It's not about taking the full breaths. It's not about taking big breaths. It's not about taking a deep breath that's typically instructed. The instruction is okay, the instruction is fine, but the interpretation often is not. There is a way to open up your airways, open up your nose and open up your lungs. It's a way to do that by changing breathing. There is a way to reduce the onset and endurance of breathlessness, even with physical exercise, not just from a psychological point of view in terms of reducing the perception of breathlessness, but also training your body to be able to do physical exercise with less ventilation. So we can train our body to make adaptations. And the thing about that then is that the individual becomes more efficient with their breathing and they have more reserve. They're less likely to gas out too soon, but there's also a relationship between how you breathe and, of course, the autonomic nervous system. Improving states of mind and increasing resilience. This is really about how can we stop thinking? And it is possible to stop thinking. It's possible to be able to put the critical mind aside, to direct your attention and focus on what you want to direct it upon. And it's not just about directed attention. It's also about improving blood flow and oxygen delivery to the brain. It's about improving your sleep, and it's about knowing techniques to help bring balance to the autonomic nervous system. From a biomechanical point of view, there's a connection between your posture and your breathing and your movement. So the diaphragm breathing muscle is not just for respiration, but it also provides stabilization for the spine. If your breathing is off, your movement is off, and if your movement is off, you're more prone to injury. And of course, with this, then there's a way of assessing it. So you're breathing from a biochemical point of view, you're breathing from a psychophysiological point of view, and you're breathing from a biomechanical point of view. So this is your foundational breathing. Always consider it's not just a breathing exercise that you're giving your clients, but it's really that you're having your client adopt normal breathing techniques into their way of life, that your client has it for life. The advanced training then is about accessing the zone. This is about mental and physical performance. We do impart psychological and physiological stressors that are controlled. In a controlled dose, we put people into a degree of air hunger so that we can reduce, again, the perception of breathlessness, but also lower blood oxygen saturation, increase carbon dioxide so that the body makes adaptations, and those adaptations would include reducing lactic acid, for example. improving respiratory muscle strength so that the diaphragm doesn't tire so quickly. And as a result, then it will reduce breathlessness during physical exercise, and improving physical performance. And this is about training the body to perform with less ventilation. So the two go hand in hand, but they're two key pillars. Now, for me, the mind aspect of it is massively important. I've been working with the mind just as long as I've been working with breathing, and I probably have a greater personal interest in the mind, in being able to put the critical mind aside, access flow states. And I think it's vitally important, because we, as individuals, we have attended an education system that has not trained us how to concentrate. And that's not a reflection of the teachers, it's just a system. You know, how many of us have spent 12 or 14 years in formal education, and at the end of it, we are not able to concentrate? And really what we need to be able to do as human beings is to have our complete and undivided attention on what we are doing in the absence of thoughts. But thoughts can arise, but certainly in the absence of thinking. There is a difference between a thought and thinking. A thought will arise, but it's when we latch onto that thought and we go down that stream of thought, and oftentimes we get so immersed in our thinking that that consumes everything that we do, to the point that we lose focus, we lose concentration, and we are so internally distracted. We spend so much of our time with inner self-talk, and oftentimes the inner self-talk is not very good. We can be quite critical of ourselves. I'd like to bring in Brandon Schultz at this point, and Brandon to communicate his experience in terms of the application of the oxygen advantage. So Brandon, if you're here, if you can unmute yourself and say hello to everybody.
Hello. That photo is very old. I think that's probably 4 years old. I think looks like I ate that old Brandon. Yeah, I think I was maybe four years ago, something like that. I took the course. I think I was in Canada at the time. I was maybe one of 10 other coaches in Canada. So yeah, really, like, I've spent a lot of time with it, with the education, with the material. And yeah, kind of like as I introduced myself in the beginning, I'm a personal trainer, strength coach. I educate other trainers online with a company called Prescript. And then for my online coaching, a lot of my clients are other coaches themselves. But something that I think a lot about with the oxygen advantage material, and especially when I start to educate other people on the training side of things, is that breathing really is like the human component of coaching, right? Like you talked about it before, like the psychosocial side, the biomechanics side, right? Controlling the biochemical side, like being able to understand, the human that comes in front of you. And everyone is going to come with different issues, whether they can't sleep, whether they're anxious, whether they can't recover from their training sessions, either during their training or post-training. And, really taking advantage of the principles that you teach and that are in your books really helps, I think, dial in that human side of it, right? Some people will come into a session and they're really anxious after a long day at work, and, spending some time on the floor, getting them to breathe and slow down their breath, right? For those people, that can be a really key performance indicator that I use, so people can get the most out of their sessions, right? So I come at it from, I'm trainer first, but everything in the breathing side comes with it. Just like you were kind of mentioning in the beginning of the presentation, that there really shouldn't be a difference between personal training and the breathwork coaching.
Brandon, I'm curious in terms of, so when you're working with your clients as well, how much of it is using breathing to improve performance from a physical point of view, and how much of it is in using breathing to improve performance from a mental point of view?
Yeah, I'd say it's like, I couldn't put a number on it necessarily, but maybe 50-50, right?
Yeah.
Like, again, dealing with general population people and athletes and things like that, the mental side of it is huge. But then again, like I do, because personal training is my primary thing, right? Breathing is kind of like the extra added benefit to my service. Being able to use breathing from a biomechanics side, even to access positions a little bit better and more efficiently, That's kind of where I use breathing a lot of the time. But even beyond that, like from the performance side, adding in breath holds and, nasal breathing only cardio, even just that and the stuff that you kind of talk about in the course is hugely beneficial for people.
Great, great. I am going to go through some of the exercises that Brandon just spoke with. There's two exercises that got me into breathing, and I'm sure you might be interested in knowing what those two exercises were. One was to decongest my nose. I always had a stuffy nose, and it's relatively common with people. And if you have a stuffy nose, or if it could be seasonal, it could be hay fever, or it could be more chronic, such as having allergies to dust mites and things like that, or if you have a head cold. There is a way to decongest the nose. And the key about being able to decongest the nose is that you can then breathe through it. And when you can alleviate a stuffy nose, your sleep is much better. So anybody who comes into me with a stuffy nose, the first thing I'll always ask them is, how is your sleep? And people with nasal congestion have reduced cognitive function. And it's not just because their sleep is impacted by the stuffy nose. There seems to be some other connection going on. And when you think about us as human beings, cognitive function is one of the most important traits that we have. It's our ability to make decisions. So to become a better decision maker. And that's applied in all areas of life. And I'm not saying that breathing is a cure-all, but I am saying that we can make much better decisions if we have better sleep, if we have balance of the autonomic nervous system, and also if we can influence blood flow and oxygen delivery to the brain. The brain consumes 20% of our oxygen. It's 2% of our body weight, and 20% of our oxygen it consumes. And it's by breathing a little bit less air that you influence blood flow to the brain. I know many of you have tried practicing slow breathing in the past, and you might be practicing slow breathing. You're slowing down your breath to maybe 4, 7, 8, or breathing in for 4 and out for 6, or you could be breathing in for 2 and out for 7, but your focus is on the respiratory rate, and some of your students can be getting lightheaded as a result of it. So what's happening is they are slowing down the respiratory rate, but because the focus is solely on the respiratory rate, their tidal volume is increasing disproportionately, so that they are breathing too much air, which is causing too great a loss of carbon dioxide from the lungs, from the blood, and this is reducing blood flow and oxygen delivery to the brain. And that's the key about breathing, that breathing is simple and it's complex at the same time, but overall, it's fairly straightforward. But of course, everything is straightforward when you have the tools. Brandon, definitely, you're a changed man. All good.
Yeah.
So
Yeah.
in terms of our functional breathing, so we've got two trainings. One is functional breathing. This is foundational breathing. This is everyday breathing patterns. Breathing from a biochemical, which focuses on carbon dioxide, biomechanical, which is focusing on the diaphragm, strength and function, and psychophysiological is the mind-body connection. And the functional breathing is all online. It's a pretty good training. It's all there. There's videos, there's PowerPoint presentations, there's quizzes, it's an exam, and there's a certificate. It's very accessible in terms of price, $316. It's $395 normally, but there's a 20% discount code there, Wellness 20, which is valid for 7 days. And then the advanced training includes the advanced exercises, the PowerPoint presentations, pushing your body, and the functional. So the advanced includes everything. And that's where I give 7 by 2 hour online sessions by Zoom. So this is online, but I also give 7 by 2 hour sessions by Zoom. And the price of that is fairly accessible too. It's normally $995, and there's a 20% discount to get it down to $796. It's always been always when I've been working with students and clients over the 22 years, is that the price is accessible. We teach volume, and with that then we can bring down price. We have a good team of staff. We've got a great community as well. So we're always upgrading and improving knowledge. There is also a face-to-face training that will be taking place. So any of you who want to do a face-to-face, Hilton Head Island, in SC, South Carolina. And you see Tiger Bai there, who's a wonderful advanced master instructor with Oxygen Advantage. And her training is from the 20th to the 22nd of September inclusive. And there's a 10% discount there. So that's a discount from 11.95, and you'll see access there. Or if you just screenshot her email address and drop her an email. Before I come to a few different breathing exercises, these here are the dimensions of functional breathing. And I want you to think of this scenario. You've got a client who comes into you, and the client says, I just feel that I can't take a satisfying breath, just can't take a deep breath, which is common with people who have suboptimal breathing. And you're wondering, well, why? What is the reasoning behind this? Is it because they're breathing high and they're not using their diaphragm optimally? And because of the high breathing and underuse of the diaphragm, they can't take a deep breath? Or is it possibly that their drive to breathe is too strong? So their sensitivity to carbon dioxide is too strong, because carbon dioxide is the gas that's the primary driver to breathe. And some of us are overly sensitive to the accumulation of carbon dioxide. And when we are overly sensitive to the accumulation of carbon dioxide, our breathing is faster, our breathing is harder, and we feel that we're not getting enough air. So the individual coming into you saying that they just can't take a deep breath, it could be a biochemical problem. But it possibly could be a psychophysiological problem, that they don't have a good relationship with their breathing. Because we have to bear in mind, whenever we have trauma or high anxiety or high stress levels, very often our breathing is impacted. And our breathing is a very personal thing, because we could have a genetic predisposition towards panic disorder or anxiety or hyperventilation syndrome. And if we have an acute hyperventilation attack, we feel that we are not getting enough air. And of course, that's traumatic in itself, because air hunger is a primal fear. So your student coming into you and they're saying, I just can't take a deep breath. How might you know where the problem is? And this is where it's important to be able to look at breathing from 3 dimensions, because ultimately breathing involves 3 dimensions. You measure the breath hold time, which will give you feedback of the chemosensitivity to carbon dioxide. So this would be the body oxygen level test that you measured yourself at the very beginning. Or you can assess your client's breathing using the high-low test. Is the individual breathing high, or are they breathing low with good recruitment of the diaphragm in different positions? Or you could have them complete the Nijmegen questionnaire or self-evaluation of breathing questionnaire. Now, also then the training. So say, for example, you notice, okay, they have a low Bolt score, it's 10 seconds, and they are breathing high. Well, my approach here would be, I want to improve the client's breathing from a biochemical point of view first, because if their breathing is poor from a biochemical point of view, so this person has a low Bolt score, their drive to breathe is quite strong. Because they have a strong drive to breathe, they feel that they are not getting enough air. Because they feel that they are not getting enough air, they're more likely to breathe using the upper chest. So their breathing that's poor from a biochemical point of view is also influencing their breathing from a biomechanical point of view. Now, if you compare this to a number of different approaches, and say, for example, you go to another breathing instructor, or, a breathing instructor that's trained in the biomechanics, and that breathing instructor then is working specifically on the person's breathing from a biomechanical point of view, but that breathing instructor may not be improving breathing from a biochemical point of view or from a psychophysiological point of view. And we have to ask, like, if poor breathing from a biomechanical point of view, under use of the diaphragm, this is what gets all of the attention, but this is only one part of the picture. And what can drive our breathing to be upper chest is persistent mouth breathing and a low Bolt score. So then we have to think of, well, how do we get the person breathing in and out through the nose? Because by breathing through the nose, it will impart an extra load from a biomechanical point of view, because your nose is smaller than your mouth. Your nose imposes a resistance to breathing. If you do physical exercise with your mouth closed, even though the air hunger is that bit stronger, it's good because this is what's going to cause your body to make adaptations that are positive. So it's amazing what you can do by simply tweaking breathing in something that you were already doing. So if you're a yoga instructor, if you're a Pilates instructor, if you're a physiotherapist, if you're a strength and conditioning coach, all you have to do is tweak how that person is breathing during different practices. Now, I'll go through this slide and then we will do some exercises. I had you measure your bolt score earlier on. This is just out of curiosity. I'm sure some of you anyway, you probably know what it is. If you have somebody with a bolt score that's quite low, now the lowest bolt score that I've seen are people recovering from long COVID, and their bolt scores were 3 seconds. In this example here, the bolt score is 11 seconds. That would indicate that breathing is dysfunctional from a biochemical point of view. And because the person is feeling that they are not getting enough air, they are also likely to breathe poorly from a biomechanical point of view. It will also impact their breathing from a psychophysiological point of view. So the simple low breath hold time here will indicate that the person's breathing is a little bit faster than normal. They feel air hunger, they sigh more, or they may stop breathing. So they have irregular breathing. They may be breathing a little bit harder, upper chest breathing. They're feeling that they're not getting enough air. Their breathing is effortless. Their breathing is effortful. Even during physical exercise, they will be overly breathless. So they will have disproportionate breathlessness during physical exercise. And that then in turn leads to a slower recovery post-physical exercise, exercise-induced bronchoconstriction, if the individual is vulnerable to airway narrowing, reduced recruitment of the diaphragm, which affects their movement. And there's other things that are going on, reduced oxygen delivery, premature muscle fatigue, etc. So this individual is likely to be breathing both through the mouth and through the nose because they are feeling that they are not getting enough air, and there's no natural pause following exhalation. Their breathing needs to be trained, and using a variety of different exercises that they incorporate into their way of life. And you know that your student is making progress in their breathwork journey if their bolt score is increasing, if they're breathing with better recruitment of the diaphragm, and if their Nijmegen score is reducing. So always bear that in mind. You could be already teaching breathing practice and you're wondering, well, what exactly is my client getting out of this breathing practice? How would you know? It's important to have objective tools so you can assess the client's breathing and that the client understands it. And it's important then that you have breathing exercises to help to target those specific issues that you see with your client. So when the bolt score is 25 seconds plus, the respiratory rate is normal during rest. Breathing is regular. The individual is not sighing. They're not sighing frequently. They're not holding their breath quite frequently. Their breathing is lighter. It's primarily driven by the diaphragm. Their breathing is easy. It's effortless. They're able to do physical exercise and it feels comfortable for them. They're not struggling to breathe during exercise, for example. Their breathing is likely to be nasal only, and they do have a natural pause at the end of exhalation. This is both a biochemical and a biomechanical aspect. So I'm going to show you an exercise to decongest the nose. Now, you can always use your phone to assess how well your nose is working. So you just get the screen of your phone, you put it underneath your nose like so, you breathe onto it, and then you look at the halo that's left on your phone. Typically, you will see that one side of the nose is a little bit more congested than the other. That's normal. It's called the nasal cycle. And if it's your right nostril that's congested and you're breathing more through your left, then you're in a calming approach. But if it's your left nostril that's obstructed and you're breathing more through your right, that's more enlivening. It's not true that the left nostril is activating the right hemisphere of the brain. That's not necessarily true. I know it's often cited, but it's not necessarily true. But what is true, based on a few decent studies involving large populations of people, was that if you block your right nostril and continuously breathe through your left nostril, it lowers your blood pressure and it increases heart rate variability, and it helps to bring balance to the autonomic nervous system. But anyway, the nasal cycle, it shifts every 90 minutes or so, and it's not fully known why we have a nasal cycle. Why does one side of the nose open up and the other side get stuffy? And it changes then every 90 minutes. But it's thought that it's related to the balance of the autonomic nervous system. So to decongest the nose, I'm going to do a few easy breath holds first, and then we will do some stronger ones. And you will know if your nose is working freely because it's pretty direct. You feel it, yeah? So whenever you're ready, I would like you to take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose for 5, 4, 3, 2, 1. Let go, but breathe in through your nose. And now just breathe normally for about 10 seconds or so, 10 to 15 seconds. So 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 5, 4, 3, 2, 1. Let go. Breathe in through your nose and breathe normally for about 10 seconds. Sorry, I had a window open there, and there's, of course, Irish rain. So you're just breathing normally for about 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 5, 4, 3, 2, 1. Let go. Breathe in through your nose and breathe normally for 10 to 15 seconds. Now I'm going to extend the length of your breath hold time. I would like you to hold your breath for about 10 head nods or 15 head nods. So whenever you're ready, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your breath for 10 head nods. And check in if is there any difference in terms of how your nose is feeling. Now, normally to decongest the nose, you need to be holding the breath for about 20 to 30 seconds. Some of your students won't be able to because they don't have that breath hold time because of poor breathing patterns. And that's not sometimes people might say that it's poor fitness levels. You could have top athletes with a low breath hold time, but that top athlete with the low breath hold time, their breathing is holding them back. But they can have immense willpower that they push through everything, but it's not good because they could be overtraining. They could be overtaxing their system. So I suppose it's really about using the breath to train us to be more efficient, that we're not wasting energy unnecessary, but at the same time, we're not overdoing it either. So let's try for 15 head nods. And by the way, don't do this if you're pregnant. Now, the last one you did wouldn't do any harm, but if you're pregnant, don't do these exercises. So whenever you're ready, take a normal breath in through your nose and out through your nose, and pinch your nose and hold, and just nod your head, 15 head nods. And then you breathe in through your nose, you let go and you breathe in through your nose. It's a very simple instruction. You can teach that exercise to children from 5 years of age onwards. I've taught it to hundreds of kids. And even with a head cold, it will help to decongest the nose. So the instruction again is as follows. You're just taking a normal breath in through your nose and out through your nose, and you're pinching your nose with your fingers. And then you're just gently nodding your head up and down. And it could be 5 head nods, 10 head nods, 15 head nods. Would be better if you do 20 head nods. And you're pushing it to the point that you feel that the air hunger is a little bit strong. And then let go, but breathe in through your nose, because the key about breathing is to breathe both in and out through your nose. As you're breathing in, the air that's coming into the body. The nose performs about 30 functions. Better recruitment of the diaphragm, better gas exchange from the lungs to the blood. When you breathe through your nose during physical exercise, you've got better blood circulation. You've got increased oxygen delivery from the blood to the tissues and organs. You can influence blood flow to the brain by breathing, changing your breathing, and it's really about breathing a little bit less air. But even if somebody does physical movement, if you do physical movement with your mouth open versus with your mouth closed, there's a fundamental difference. You get so many different advantages just keeping your mouth closed during physical exercise. Can we try the nose unblocking exercise again? We kind of have to do it about 5 or 6 times. So whenever you're ready, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down, holding your breath. And keep relaxing into your body as you're holding your breath. You might start to feel involuntary contractions of the diaphragm, and keep just relaxing into the body as you hold your breath. And as you hold your breath, it induces a stress response, and it's taught that it's the increased stress as a result of the breath hold that causes the blood vessels in the nose that have swollen to shrink. So that's why it feels easier to breathe through your nose. Try that the next time you have any congestion of the nose, or if you've got hay fever, stuffy nose, etc. And always think of your students. If your student has a stuffy nose, they don't feel comfortable breathing through their nose, they're more likely to breathe through an open mouth. Open mouth breathing is faster breathing and upper chest breathing. That affects their breathing from a number of dimensions, but it will also affect the state of mind. So it's quite useful. And coming back then to our next run of slides. So we spoke about that one there. And we were chatting with Brandon about this actually in terms of a personal trainer. Like a personal trainer will always tailor a physical routine based on the age, the physical fitness, and the state of health of the client that they are working with. So a personal trainer will have very light physical exercise, moderate physical exercise, strong physical exercise, and then sprinting, more extreme physical exercise or maximum physical exercise. But with breathing, it's the same. We need to tailor breathing exercises based on age, state of health, and in this instance, Bolt score. So when the Bolt score is quite low, we do breathe light, breathe slow, breathe low, nose breathing in and out during exercise, during sleep, during rest, humming, for example, as well. So this is targeting breathing from 3 different dimensions. And then as the Bolt score increases, we bring in some breath holds with light, slow, and deep breathing. So we do bring in the light, slow, and deep, but also some breath holds and also breathing during physical movement. And then as the Bolt score is 20 to 25 seconds, here we push the individual. We use breath holds to lower blood oxygen saturation, increase carbon dioxide. And these are quite strong. So these are strong, would be severe hypoxia, but not extreme at this point here. So it would be strong. We typically lower blood oxygen saturation down to about 85% or so. That causes the body to make adaptations. And this would be stimulating anaerobic glycolysis even during jogging, but it wouldn't be traumatic for the individual, provided that it's suitable to their Bolt score. And then if you really want to push it, you could do, say, for example, hyperventilation, which is fast, hard breathing in and out through the nose would be ideal, followed by breath holds. And this would be when you're lowering blood oxygen saturation into the 70s. I'm not a fan of dropping it below 70% and certainly not below 60%. And the reason being is because there's a risk of passing out at 60%. So we monitor it with blood oxygen saturation. This is not a major component of what we do. We tend to stick with the light, the moderate, and the strong exercises. But I include this because it is a popular breathing technique, and people can get a lot out of it. But again, it's like tailoring any breathing approach to the student that you're working with. And then you can see the potential of breathing. Like there's a massive potential. any student that you have coming in your door, being able to assess their breathing, improve their breathing, but also using breathing exercises as a means of getting maximum physical and mental performance. Okay. So now what I'm going to do is we're going to do some breathe light exercises. And I'd like you to give this a go. You know, maybe in the past you've practiced breathing full big breaths. Now we're going to do the opposite to that. So what happens? And it's all about the experience of it. So with this, I would like you to have one hand on your chest and one hand just above your navel. And for you to take your attention out of your mind and onto your breathing. So you have one hand on your chest, one hand just above your navel. Taking your attention out of your mind and onto your breathing patterns. As you're feeling the airflow coming into the body, you might feel it coming in and out of your nose, the slightly colder air coming into your nose, the slightly warmer air as it leaves your nose. You might feel it at the back of the throat, so you might feel the air there. You might feel it in the chest. You could feel the movement of your body in terms of your breathing. Or you might feel it in around the area of the diaphragm. So there's only 4 places at which we can feel airflow coming into the body: the nose, the throat, the chest, the diaphragm. So wherever you feel it. Now you might find it easier just to feel the airflow coming in and out of the nose. So as you feel your breathing, I would like you to start softening and slowing down the speed of the breath as it comes into your nose. So as you breathe in, really soften and slow down the speed of the airflow coming into your nose, almost as if your breath in is imperceptible, that you're hardly taking any air into your nose. And then as you breathe out, to bring a total feeling of relaxation to the body and to allow a slow and relaxed and a gentle breath out. And then as you're breathing in, is to take a very soft and slow, gentle breath as it comes into your nose. Can you breathe that your breathing is so smooth that the fine hairs within the nostrils do not move, that you feel hardly any air coming into your nose? So you feel hardly any air coming into your nose, and then you're having a really relaxed and a slow and a gentle breath out. The objective here is that you're softening your breathing to the point that you take about 20% less air into your body. It could even be 30%. So this is about deliberately under breathing, just with relaxation. Softening the speed of the breath in. You're not holding your breath, you're continuously breathing, but you're just breathing lighter. So in original yoga, when breathing originated in yoga, whether it's 2,000 years ago or 1,500 years ago or even 5,000 years ago, the origins of breathing in yoga was very much an emphasis on light breathing and subtle breathing. It was only in 1880 that the instruction changed due to a hygienic movement in Europe to take full, deep breaths. That wasn't the original in yoga. The original in yoga was about conservation of the breath, subtlety of the breath. So I would like you to breathe subtle breathing, light breathing, that as you breathe in, it's almost that you have such conservation of the breath that you have hardly any air coming into your nose. And then with the exhalation, you're having a really relaxed and a slow and a gentle breath out. There is a saying that we would use in our own classes: don't be too greedy with your breathing. Don't be too greedy with your breathing. You're taking a really soft, gentle breath in through your nose and a relaxed and a slow and a gentle breath out. Now, the objective is that you feel that you're not getting enough air during this exercise. So I would like you to soften and slow down your breathing to the point that you feel that you would like to take in a deeper breath. You're doing it correctly if you feel that you're not getting enough air. The sensation that you're not getting enough air, it's not because your oxygen has dropped. The sensation that you are not getting enough air signifies that carbon dioxide has increased a little in your lungs and blood. And as carbon dioxide increases, it influences your blood circulation and your oxygen delivery. Ironically, during that exercise, even though you're breathing less air, it's likely that your blood flow to the brain will have increased by 6 to 10%. And this is a calming effect on the brain. And I think you will have experienced this in the past. If you were feeling stressed and you took full, slow breaths, and then you start feeling lightheaded, that's not because of super oxygenation delivery to the brain. That's because of reduced blood flow and oxygen to the brain. So if our goal as human beings is to optimize blood flow and oxygen delivery, it's not about taking full big breaths. It's not about breathing more air than what we need. It's about breathing normally. But many of us, because of modern living, we don't breathe normally. We breathe a little bit faster and a little bit harder. And as a result, then, that harder and faster breathing can impact our blood circulation. It can be quite common for us to have cold hands and cold feet. So cold hands and cold feet is synonymous because of blood vessels constricting. And also with that, you get a brain fog. So these are the exercises that got me into breathing. I'd practiced the full big breaths. I never got anything out of them. I remember going into an exam in 1996, 97, a pretty important exam that I was doing. As a chronic mouth breather, I was anxious going into the exam. I had read a book about breathing back then, and I took a walk for about 2 minutes before I went into the exam. I took these full big breaths for about a minute, not for maybe 2 minutes at most. And I walked into the exam and I was totally disoriented. I was lightheaded. So I deliberately reduced blood flow and oxygen delivery to my brain, but I didn't know I was doing it. I thought I was doing it for the better, but it wasn't, obviously. I should have done the opposite. Can we go with this exercise just again? And with this is an interesting exercise because on one hand, you're breathing a little bit less air, and that creates air hunger, which can be a little bit uncomfortable, but it's no different than if you went for a fast walk. You know, you feel breathless if you go for a fast walk or if you're doing your yoga or whatever movement you're doing. But the only difference is that you're experiencing the air hunger sitting down. So air hunger is a slight stressor. Okay. Does that make sense? Because it's a little bit uncomfortable. At the same time, the increase of carbon dioxide, which is generating that sensation of air hunger, carbon dioxide can stimulate the vagus nerve. So on one hand, you have reduced volume breathing. When you're breathing less air, you're feeling air hunger. That's a stressor. But on the other hand, reduced volume breathing, which is increasing carbon dioxide, is activating the body's rest and digest response. So what side is outweighing the other? Is the air hunger causing a greater psychological stress than the physiological relaxation induced by stimulation of the vagus nerve? Does that make sense? How might you know? Pay attention to the saliva in the mouth. Pay attention if you're feeling sleepy. If you activate more relaxation by breathing less, you will have increased watery saliva in the mouth. You've activated the digest response, and you will feel drowsy. You've activated the rest response. But if the air hunger is outweighing the relaxation effect, your heart rate will speed up a little bit. So therefore, the air hunger has been just a little bit too strong for you. And the thing about air hunger, we all have a personal relationship with air hunger based on our prior experience. So if you notice that the air hunger is a little bit too much for you, and you're finding that your heart rate is a little bit too high, take a rest and just do it very, very nice and easy. So it's a brilliant exercise, by the way. And it's a brilliant exercise because it's a combination. It's almost that you're teetering on the brink of relaxation and a psychological stress. And there's so much going on here with this exercise. Okay, so let's give it a go. Now, by the way, it's totally under your control. So if you don't feel comfortable doing it, well, try it anyway. But, you know, if you're doing it and you're feeling that the air hunger is a bit too much for you, you just take a little rest from it. That's all. Yeah. So one hand on your chest, one hand just above your navel, bringing your attention out of your mind and onto your breathing. And as you feel the airflow coming into your nose, I would like you to really slow down the speed of the air as it's coming into your nostrils. Almost that your breath in is imperceptible. And on the breath out, bring a total feeling of relaxation to the body, that you're having a relaxed and a slow and a gentle breath out. And again, when it comes to the breath in, that you're having a really soft and slow and gentle breath in, almost that your breath in is imperceptible, that you're hardly breathing at all, that you have such conservation of the breath. So you're conscious of not taking in so little air is coming into your nose. So at this point, so little air is coming into your nose. And then at the top of the breath, a total feeling of relaxation to the body and a relaxed and a slow and a gentle breath out. And it's especially important that as you breathe out, that you bring a feeling of relaxation to the body and you allow the air to leave the body effortlessly. As you breathe a little bit less air, maybe 20% less air into the body, maybe 30%, that will cause a slight accumulation of carbon dioxide in your lungs, which in turn will increase carbon dioxide in the blood leaving the lungs, which in turn will dilate your blood vessels. So your blood vessels now are opening up. You have 50,000 miles of blood circulation in the human body, and they will be opening up by the slight increase of carbon dioxide. It's also likely to stimulate the vagus nerve, and it can induce relaxation and activate a digest response. Pay attention to the saliva in the mouth. If you're feeling stressed, your mouth goes dry. If you're feeling relaxed physiologically, even though you feel air hunger, you will have increased watery saliva in the mouth, and you also feel sleepy. We use this exercise for reducing the chemosensitivity to carbon dioxide, improving breathing from a biochemical point of view, anchoring attention onto the breath, increasing blood flow and oxygen delivery to the brain. The brain, by regulating breathing, controls its own excitability. How can you improve blood flow and oxygen to the brain? It's not by breathing more air. Breathing more air does not do it. Breathing more air reduces blood flow and oxygen delivery. So when you're doing this exercise and you're breathing that little bit less air, you will have increased circulation. And that's just based on physiology. If you look at the functions of carbon dioxide, look at the Bohr effect, BOHR, discovered back in 1904, that hemoglobin is the main carrier of oxygen, releases oxygen in the presence of an increase of carbon dioxide and resultant drop of blood pH. So the reason I talk about it is because I know from working with so many people over the past that when they first hear about the importance of breathing less air, it can be confusing because they have been told to take full, deep breaths, possibly for decades. But that idea only started in 1880. Before that, it was about light breathing and subtle breathing and conservation of the breath. And see, the thing about breathing is, if it makes an impact and if you can feel a difference in your body, you will get it. And I'll give you countless examples. If I'm doing public presentations and if I feel my heart rate is a little bit increased, I can bring down the speed of my heart rate 2 minutes before the event, put my critical mind aside, have my attention dispersed throughout the body, and go out there and talk with every cell of my body. So flow states can be accessed at will. They can be reproduced. And if I can do them, anybody can do it. All it takes is a little bit of practice, you know. By the way, did you have air hunger as you were doing the exercise? Yes. Did any of you notice, is your mouth on drier, or was there increased watery saliva in the mouth, or was it the same? If you just put it into chat, I'm always interested in. So for some of you, your mouth goes dry because the air hunger is new and it can be a little bit too uncomfortable. And for some of you, you've got increased watery saliva in the mouth. And also the previous exercise, the nose and blocking. Did any of you notice, was your nose getting freer, or was it the same or getting worse from doing the nose and blocking exercise? So even just the two exercises that we looked at today, you can open up your airways, not just the upper airways, but also your lower airways by doing nose and blocking exercise, breathing through your nose. You can then influence your blood circulation and oxygen delivery just with two simple exercises that you can learn them in a few minutes. So there is a lot going on in terms of breathing exercise, and this is the power of breathing. And this is having a toolbox that any client who walks in your door, if they have asthma, you can help them. If they have poor sleep quality, you can help them. And we have different tools, etc., with this as well, improving their focus and concentration, improving their breathing from a biomechanical point of view. Or if they want to get the extra edge, so we'll say they are a rugby player, a football player, or a boxer. So we have some Olympic athletes at the moment that are using Oxygen Advantage, and they have been competing. And one individual, as far as I know, he won gold pretty recently, and he's in the UK. So he's an Oxygen Advantage instructor. So athletes are practicing it, putting it into practice, which is pretty cool. Our training, it will give you the tools for your clients from a number of different dimensions, but the ability to explain why, what are these breathing exercises doing? What are the benefits? To explain the science behind them, which is very, very important, because for a long time, breathing was seen as left of field. People weren't really taking it seriously. And I don't think breathing gave its full potential. It's not just as simple as telling somebody take a full deep breath. It's going way beyond that. It's about bringing breathing into your way of life, that it's always there for you. It's great for states of mind. And being able to tailor breathing according to the client that you're working with, and to evolve the techniques as your client is improving. So again, the last slide, there's a number of different options. You've got the functional breathing, which is all online. You could start that today, for example. It's all there. And there's about 11 hours, 11 lectures. They're all very recent. I only recorded them about 4 weeks ago, so they're very recent. You've got PowerPoint presentation and a video going through each slide in the PowerPoint and explaining step by step. And a lot of good stuff in the functional breathing training. So that's all online. And then the advanced, you could start that immediately as well. The advanced includes the advanced techniques and a lot of PowerPoint presentations for corporate, for example, working with fighters, working with military, police, first responders, and also the functional. And this does include 7x2 hour sessions. So, but you could, the last training that I gave that was online, that was recorded, you have access to that straight away. So you could go through the 7x2 hour sessions from a training that I gave only about 4 weeks, maybe 6 weeks ago. So that's there. So they are different prices. The functional breathing is $316 once you use this wellness code here, wellness20, and the advanced is $796. And again, when you use this wellness code. And then, of course, in-house with our excellent master instructor, Tiger Bai, and this is in South Carolina at Hilton Head Island. And this is $1,076. So that's for in-house training, but you do also get access to the training portal. So I'm going to open up the floor to some questions and answers, and I'll try and answer any question that you have. So the floor is all yours. So don't be shy. I'll be here for about 30 minutes or so. I might be able to answer everybody's questions, but I will do my best. Yeah. Are there payment plans available from the advance? Do you know? I don't know that. Niamh, do you know if there is? Yeah.
Yes, there's payment plans available. I'll write back to you now, Kimberly, and you can email the sales team and they'll let you know about the payment plans.
Great. Thanks, Niamh. So I see that's, I'm just going through here. So from Pamela, if you've been certified with you through Buteyko training, would you say that the functional breathing coach is too similar? Yes, Pamela. If you've done Buteyko clinic, you've done functional breathing. It's part of that there. So yeah. The main difference with Oxygen Advantage is that it's the Oxygen Advantage Advanced is the application. So Buteyko is very much about a deep dive in health, mental health issues, respiratory health issues, and sleep disorder breathing, and working with children. Whereas Oxygen Advantage is more about performance. It does include physical performance and mental performance, but it wouldn't be the same deep dive as, say, working with somebody with panic disorder. It's really the client. I was teaching Buteyko for years, and everybody coming to me were coming with a health issue. and healthy people weren't coming to me, and men weren't coming to me, more women with Buteyko. So that's why I started writing the Oxygen Advantage book about 11 years ago or 12 years ago. So it's for performance based. Yeah. But of course, there is an application for health, but it's not the same deep dive as the Buteyko. 2 questions. How long should the natural pause be at the end of exhalation? It depends, Marta, on your Bolt score. Typically, when your Bolt score is about 18 seconds or 19 seconds, the natural pause is about 1 second. So when you breathe out, there's a natural cessation in the breath before you feel the need to breathe in again. Now, as your Bolt score increases, the natural pause then can increase to 2 seconds and possibly even 3 seconds, but typically 2 seconds. And that would be when you're in a state of rest. We don't put the natural pauses in there. We always allow the respiratory rate look after itself. When you work with improving your Bolt score, then your respiratory rate looks after itself. So you always allow the respiratory rate look after itself, unless you have somebody who's doing, say, a lot of irregular breathing, where you feel that you have to retrain their breathing from a timing perspective. And then we bring in slow breathing. So this would be when somebody has a poor relationship with their breath, because some of the people that you're working with, they do find it difficult to bring their attention onto their breath, and very often that could be stressful for them. So then we have to use different breathing techniques whereby you don't have to place attention to breathing to make that change. Enjoy your vacation, Nikki. So I'm just going to scroll down here. With exercise, do you do anything specifically to lessen the congestion that happens as you fatigue or have increased air hunger? With exercise, do you do anything specifically to lessen the congestion that happens? So I'm sure this is your nasal congestion. You may be talking about a runny nose, Marta. It's kind of normal to have a runny nose, by the way, when you do a physical exercise. So you'll have to bring a tissue with you. It's normal because there's a lot of airflow going in and out of the nose. It does improve with practice, but your nose has a lot of work to do. And in the process of conditioning all of that air, it can produce quite a bit of mucus. But the benefits of nose breathing versus mouth breathing, there's no comparison. It's not normal to breathe through our noses. So I suppose the question that I always say to my students, what's in the mouth? Our teeth, our tongue, hard palate, soft palate, throat, gums. Do any of those things do anything for breathing? Does our teeth do anything for the breath? Our tongue do anything for the breath? The hard palate do anything for the breath? The soft palate do anything for the breath? The throat is the only one. Air goes straight down the throat. So everything in our mouth is not for breathing. Everything in our mouth is for eating, for speaking, for drinking, and for social bonding. Our nose does everything when it comes to the breath. And the other interesting thing is that if you do your physical exercise with your mouth closed, your nose naturally opens up during physical exercise to allow more airflow in and out of the nose. And that's another point that nature is telling you that your nose is for breathing, even during exercise. Thank you, Cynthia. I appreciate your tour. I ask clients to begin by moving low rib cage to use of the diaphragm. And the other thing that I would say, Cynthia, is always consider biochemical dimension. So the biomechanical dimension is great. It's very important, but also the biochemical dimension. What's the person's sensitivity to carbon dioxide? And also, given that we've got a few females here, female breathing changes in accordance with phases of the monthly cycle. So a man's breathing is more stable, whereas a female breathing, different phases of the monthly cycle. So say, for example, menstruation, follicular phase, proliferation, ovulation. Post-ovulation, mid-luteal phase, there's an increase in progesterone, which is a respiratory stimulant. So the female's breathing typically gets that bit faster and harder post-ovulation, mid-luteal phase. And if the female has a strong sensitivity to carbon dioxide, she's going to be more vulnerable to the symptoms of PMS. And, so if, for example, a female, if she measures her Bolt score at different phases of the monthly cycle, and then starts to notice that, yeah, her bolt score is dropping by, say, 25%, if it drops quite significantly, post-ovulation, mid-luteal phase, you know then that there could be a connection between her breathing and the symptoms of PMS. And there was one paper written on it in 2006, and the authors said that it would be important to start looking at breathing, especially females, that they can have a strong chemosensitivity to carbon dioxide, the females with PMS. Yeah. So pain can be a part of that, of course. Sorry, I'm just moving on down. Does oxygen advantage get into changing the structure? 1 second. I'm just, sorry there, my thing is a little bit stubborn. Mewing is on the rise more and more, and although many have focused on aesthetics, does oxygen advantage get into anything as it relates to tongue suction? Kyle, we have worked a lot. Mike Mew, for example, I wrote a book with mewing 14 years ago, ever before mewing was known. I spoke with Mike only a couple of weeks ago. So we always have brought in mewing and the whole concept of orthotropics into our breathing, more so though from a Buteyko point of view, because the people who would do the Buteyko clinic method are dentists. So dentists will be probably the biggest cohort, and they will be interested in breathing for sleep and craniofacial development. So I wrote a book published in 2010 called Buteyko Meets Dr. Mew, and you will see specifically the principles there. And of course, to practice mewing, it's all about correct tongue resting posture. And John Mew, who's now about 96 or 97 years of age, he wrote the foreword to that book. But I've also included his work in The Oxygen Advantage and other books as well. Yeah. So I think it goes without saying. I have a 21-year-old man. I have a 20-year-old athlete, and his breath is inverted in his belly in. So he's got paradoxical breathing. What should be the first step other than bringing attention to his breathing? It would be interesting to measure his bolt score. And I would be specifically working with him from a biomechanical point of view. I'd probably use something like a breathing belt, the Buteyko belt, just to bring awareness to the area of the diaphragm. I wouldn't be focusing so much on the movement of the belly, but I would be focusing more on the movement of the ribs. I also think that, Morel, that you would need to have probably a diaphragm release or a diaphragm massage. So somebody who was able to be hands-on with him. So to use breathing protocols to improve breathing from a biomechanical point of view, but also he needs hands-on intervention. So getting into the diaphragm, massaging the area of the diaphragm, helping to release that. But ultimately, we do want free movement of the diaphragm. And of course, as the breath is drawn into the body, the diaphragm is moving downwards. We do want movement to the sides. So we're more focused on lateral expansion and contraction of the lower ribs. And maybe that could be the focus. Now, sometimes when you get individuals to bring their attention to their breathing, they breathe paradoxically because they're placing so much attention on it. It might be an interesting one is to have the individual lie on his back with his knees bent and have him just do relaxation, or have him do something that his mind isn't on his breathing, and just see how is he breathing naturally. Also then have him sitting down, see how he's breathing. Have him walking, see how he's breathing. So that will give you a better idea of the high-low test, because I know sometimes that people do become so conscious of their breathing, they get confused, and then that's when it starts to kind of play up a little bit. But yeah. Thank you, Annie. I'm just seeing patience. Thank you. So is there any more questions, by the way? You're very quiet. Don't be shy. Okay. If you're comfortable enough, and I think I'm kind of going through the questions here. Can the buildup of carbon dioxide cause a feeling of panic? It can, especially, Veronica, depending on the individual. People who are prone to panic disorder can have a stronger sensitivity to the accumulation of carbon dioxide. They can have a stronger alarm to it. And it's very important then with those groups of people who are prone to panic disorder or anxiety that we desensitize their reaction to the accumulation of carbon dioxide, which can be done, but the dose has to be very, very tailored. So, if people don't have a good relationship with their breathing, and given that 75% of people with anxiety and panic disorder don't have good breathing, 75%, and cognitive behavioral therapy does not change the underlying respiratory physiology. And that's another interesting one. And breathing training, light and slow breathing, has been proven to be as effective as CBT, but through a different mechanism. So I often have to wonder if there is an individual with anxiety and panic disorder who's getting benefit from CBT, that individual can also practice breathing training, and it can improve their sleep and change their underlying breathing, which will be very important. You talked a little about breathing for recovery from exercise. Is this something that is impacted by breathing during exercise? Yes, it is, Renee. If you breathe with your mouth closed during physical exercise, you will have increased oxygen delivery to the working muscles. And initially, when you switch from mouth to nose breathing during exercise, the air hunger is stronger. But the more you do your physical exercise with your mouth closed, the body adapts to it. And then your breathing is improving from a biochemical and a biomechanical point of view, and your recovery post-physical exercise is better. I have a podcast up on YouTube with an ultra marathon runner called Iher Veris, and he completed a marathon called Barclay Marathons. It's 60 hours of running. It's probably one of the most toughest ultramarathon ever that was devised. And he completed it there about 6 months ago, but he came in first. And his training was oxygen advantage. He did it from the book. The air hunger is what provides the brain with more oxygen. No, the air hunger is the brain's reaction to the accumulation of carbon dioxide and the slight drop to blood pH. So oxygen is not the primary driver to breathe. It's only if our oxygen levels drop by about 50% does oxygen drive our breathing. The primary stimulus to breathe is carbon dioxide. But the problem, Stephanie, with some of us is that some of us can be overly sensitive to the accumulation of carbon dioxide, and then our drive to breathe is quite strong. So we breathe faster and we breathe harder during rest, and that can cause a greater stress response. And the other thing, then it can impact our sleep and it can impact our state of mind. So yeah, the air hunger that we practice during the breathing exercises is not indicative of a change of oxygen. In actual fact, with the breathe light exercise, even though you're breathing a little bit less air, there's increased oxygen delivery to the cells. It's not so much about the air that comes into your nose or mouth that's the key. We have to think about downstream. There is a way to breathe to improve the volume of air that gets down to the small air sacs in the lungs, alveolar ventilation. There is a way to breathe to improve gas exchange, oxygen transfer from the lungs to the blood. And there is a way to breathe to improve oxygen delivery from the blood to the tissues. So when people think about breathing, they think about nose, mouth. But what's more important is your breathing pattern, which is influencing what's happening downstream. And the breathe light, like breathing through the nose, will automatically enhance alveolar ventilation, especially with slow breathing. And breathing through the nose will increase oxygen transfer from the lungs to the blood by nearly 10%. That's known since 1988. There was a researcher, Swift. So, and I'll show you the reference of it because, I think as well, people don't talk enough about this when they're teaching breathing. And this is just taken from a medical textbook. Dr. James Bartley, he's an ear, nose, and throat doctor, and he references this paper here by Swift. So the nose provides a resistance to both inspiration and expiration. that's twice that of the mouth. That's very important because it slows down breathing. It adds an extra load onto the diaphragm. It draws the air into the lower regions of the lungs in comparison to mouth breathing. And also by breathing out through your nose recovers the heat and moisture from the exhale breath. So it's important that the body recovers the heat and the moisture. And in a study of arterial oxygen levels, so the PaO2, before and after jaw wiring, which forced individuals to breathe continuously through their nose, the partial pressure of oxygen in the arterial blood increased by nearly 10%, just by nasal breathing, you know. So it increased. The PO2 is the entire concentration of oxygen. And of that, it will be carried in the blood, some of it dissolved in the plasma, but the majority of it is carried bound by hemoglobin. And during nasal breathing, during exercise, nasal breathing reduces the fraction of expired oxygen. So again, if you breathe through your nose during physical exercise, you will have increased oxygen delivery to the tissues so that you're not breathing out as much oxygen. Your body utilizes oxygen better when you breathe through your nose during physical exercise. Now, initially, the air hunger is that little bit stronger. Can you include a link to that study, Katie? It's taken from a textbook. I don't have the reference to hand. Sorry, 1 second for that paper. This is a textbook, so I may not have the reference so easily for you. 1 second. So I'm just going to Swift. Yeah, it's not going to allow me to recognize the text here. But Swift A, and the name of the paper is Oronasal Obstruction, Lung Volumes, and Arterial Oxygenation. It was published in Lancet in 1988. So Swift A, Oronasal Obstruction, Lung Volumes, and Arterial Oxygenation, published in Lancet 1988. So you will be able to pick it up from there. I just can't do a copy and paste, sorry. Okay, I might draw it to a close because I think actually we've covered questions. And I would like to say thanks very much for coming in and attending our masterclass. If you are considering breathing as part of your modality, I think it's really important. I think it's a very, very powerful modality that you can apply alongside what you're already teaching. And we would love to teach you if you are considering breathing training. So I will leave it at that. And thanks very much. And thank you to Niamh and to everybody else for joining us and for staying with us. Thank you.